Today, as the world is fighting with a mutated virus, the COVID 19 pandemic has had a considerable impact on the delivery of oncology services in India. Hello, and welcome to another special segment of Unplugged TV India. As India is moving forward amid the pandemic scare, cancer remains the number one concern for all health workers around the globe. Recently, World Cancer Day was celebrated across the globe. Today, we have with us Dr. Shekar Salkar from Manipal Hospital and a president of Gokarna Oncology Association. With an experience of 25 years in oncosurgery, Dr. Salkar has been treating patients dealing with cancer. Hello and welcome to Unplugged TV India, sir. As we all know, the long term impact of COVID 19 and cancer is going on. And due to COVID 19, the detection or the testing of cancer has been depleted. So, what is your view on this?
The biggest problem we are facing now, because when it started in 2020 and 2021, now it's 2022. People were, worried to come to the hospital and get themselves investigated. Even those who knew that they had a malignancy, still they were hesitating in coming for surgery or some chemotherapy. And over a period of time, we have missed a lot of cancers which was, they have now coming in the late stage of cancers, because they were having symptoms but they were not coming to the hospital, so they are late detection. So there are two or three problems. One is late detection. Second is we knew that they have cancer and we could not treat them because they had there was active that first, at least was 21 to around 2 months or so, when there was a lockdown and other things. That time even everybody in full hospital was working at a very minimum level. So that time we wanted to operate, but patients was reluctant to get operated because the side effects would have been more. If by turns out to be positive later on, then it would be really problematic. So that was one thing. And now we are also getting patients who have been detected, and we have treated them with some chemotherapy or something temporary to tide over the crisis. So it's not the right cancer treatment to they have received. This time, I think this time there is not a problem much, because even we are, we are just waiting for around 10 days and we are doing all the treatment which is needed. This with Omicron, this the third wave, what we have seen. I think because people are also getting more confident. The doctors also are all vaccinated. Full staff is vaccinated, so they are, just take a preliminary whatever care we need to take with wearing of simple PPEs and all, and we take good care. And last this month only, we have operated quite a few number of patients, and we are not having seen any major, complications and all. Yes, there's a big problem. It was there in stage one, means first wave and the second wave. But third wave, I think not much to be worried about.
In terms of cancer types, which has the more mortality rate right now?
The mortality now is okay. In first and second wave, the mortalities were more little bit because the complications were more. But we have not seen drastic change in our setup at least. But some papers have been published where they felt that in stage one and in wave one and wave two, there were complications were more, and even some deaths have occurred post-operatively where a patient who have contracted the disease in the hospital also of COVID. They were not COVID positive when they started, but in the hospital also setting they have started getting COVID, and then bad luck that they had all the problems and they could not be saved. But that's not a huge number as such. The main problem was the delay in the treatment, which has caused that delay in overall cancer. Has become more, stage increases from stage. Suppose you diagnose in stage 2, and then by the time they come to actually for surgery and all, it becomes stage 4 and all. Then it is a really painful to see that we could have done something and we could not do anything for him.
So, are there any new technologies or methods, medicines which are in progress or have been in market for the cancer treatment?
There are lots of changes. Actually, when I passed out, there was hardly any treatment available for lung cancer and all. We used to see almost all cancer patients in stage 4 on the lung cancer, especially, never survived more than 6 months that time. If they are not operable, they would not have survived for 6 months. But today we have got lots of medicines which are tablets which are available, Then immunotherapy is available. A lot of things, new chemotherapy drugs have appeared. Most important is the next sequence generation. This genetic decoding is available. We know exactly which chemotherapy will work for them. So there is a, no, though it is costly, but it is available today, that we can find out exactly which medicines will work in this condition, and we can give him that medicine only. So the chance of getting increasing the survival is very much high. Immunotherapy also has increased the survival of the people. Some tablets, like EGFR, we are doing the test like EGFR, CALC, and if it's positive, we give exactly the same medicine which is helpful in those medicine. So overall, there is a tremendous improvement in the survival has occurred. Maybe not in a very early phase. Early phase, there is no changes. For stage 1 and 2, I think this treatment has remained same, other than saving the organ, which is there for quite a long time now. Previously, we used to remove the full breast. Now we are not removing the full breast. Previously, we used to remove the larynx and all. Nowadays, chemo RT available. Better radiotherapy machines are available. A lot of robotic surgeries going on, which are difficult surgeries in thymus surgery, or thoracic surgeries. There is a lot of changes have occurred in terms of surgical problem. But main important part is the chemotherapy drugs and chemotherapy immunotherapy, which has really made a deep impact on the survival of the patients. Yes,
Okay.
it is costly, yeah, mind you. Nothing is cheaper, but it is costly. But anyway, when the life is at stake, the cost is does not matter, and the cost goes down over a period of time. When the immunotherapy started, the monthly cost was around 5 lakhs, 5 lakhs, and you have to continue that for till you respond to the treatment. Now the treatment, I think the cost has come down to maybe around 1.5 to maximum 2 lakhs. So that it is decreasing. Maybe over a period of time, it will further go down. So the price goes down as the time increases, and the important is that the patent and all those things which are intellectual rights are there. Once that goes, and then becomes, Indians are very brilliant in that film. They bring out their own medicines, and it becomes very, very cheap, very, very cheap.
So, is there any schemes which can be helpful for the poor section of the society in order to get
In
these
Goa, there is a
treatment?
fantastic, yeah. In Goa, there is a fantastic scheme about Deen Dayal this DDSSY, Deen Dayal
Mhm.
Swasth Suraksha Yojana, which is for all patients. Huh? It is not only for BPL and all those things. It is for every citizen of Goa can avail that you are affording or you are non-affording. So you can ever, and that all stage 1 and 2 cancers are covered in this, all including their chemotherapy, their radiotherapy, all surgical procedures of all stage 1 and 2. Only these late stages which are there, that is not covered, but it is like an incentive to come early, and you will spend less. Like in breast cancer, when otherwise in a private sector you would have spent around 4 to 5 lakhs for the full treatment. Today you can complete the treatment by spending your own amount, not more than around 20,000 or so. Rest all government gives you free. So that is a fantastic scheme which has come. Plus, those who want to take higher, like don't want to stay in general ward, wants to stay in a semi-private or private ward, also they can take this as a subsidy, so that that money can be minus from their final bill. So it's like some amount of subsidy for the people who can afford, and for really poor and BPL patients, I think we can do everything free.
Okay. So, if I talk about particularly of Goa, the GSB community, there is a. It has been seen that the ladies from GSB community are more prone to certain cancer. Is there any specific reason for that?
So exact study is not done. I don't think I can make a very categorical statement that they are having more chance of breast cancer, or colon cancer or something like that. But overall, if you speak, we can't make out. There is no proper study done on this to make a categorical statement. But one statement which I can make: Goa is the best in terms of compare of cervical cancer. The
Okay.
cervix, that means the mouth of the uterus, that cancer is the least cancer what we see amongst our population. When it is number 2 cancer in all over India, we are hardly we see this type of patients, maybe around 45 to 50 patient new patients per month we can see. But we are worst actually in colon cancer, intestinal cancer, compared to all over India per lakh of population. If you see, we are very much high on colon cancer because our diet is all in terms of like a US, like a lot of butter, cheese, and then red meat.
Okay.
Christian population is high. Even Muslims take a lot of red meat. Our Hindus also are, they love this red meat. So the chance of people take a lot of red meat in their regular diet, and the processed food also is quite high. So this is one of the indications for to not one of the high risk patient is a red meat and processed food. So that because of consumption is high and the diet is more like a Western diet, so
Mhm.
chances of intestinal cancer is very high compared to all over India. Even if you see
Oh.
all over India, we are number one in colon cancer, and we are best in actually cervical cancer. That is because of good STD program which is government is running, sexually transmitted diseases program which government is running, so that these Anganwadi workers and the public health worker go and tell them how to take care of their genitals, so that keeping them healthy has got a very important role in cervical cancer. So that virus, that HPV virus, that is
Mhm.
one we know now that HPV virus is the cause of cervical cancer, that is much low, and so the people can have a less number of cervical cancer. But because of the diet, we are colon cancer. Breast cancer is high. I don't say that breast cancer is not high, but it is on par with the metro cities in India, like how much it is in Bombay, in any urban city of India. We are on par with this, and Goa is considered to be one city only. You can't divide Panjim as one, or North Goa one, South Goa one. Full Goa is considered as one urbanized state also. So we consider,
Mhm.
whenever we take the the statistics in Goa, we consider Goa as a one state, as a one urbanized block. So that the whatever statistics we have, little statistics we have, is for the full Goa. Yes, in Salset area and coastal areas, we see breast cancer which are much higher than the hinterland of Goa. And as you say, the more educated people and more sophisticated people, higher elite people, their chances of getting breast cancer is high because of they marry late, they have less number of children, breastfeeding is much less in that strata. So all the risk factors which are there for breast cancer are seen in all this elite population. That's why breast
Okay.
cancer is seen more. We have almost, I would say, around 300 new patients of breast cancer in small 7 lakh population, which is quite high actually.
So recently, Indian government increased the age of marriage in girls. So does that also affect uh, breast cancer?
Actually, like from 18 to 21, it will not affect. I would, my advice will be if to have a marriage somewhere around 25 to 27, have your first child fast, give a good breastfeeding. The first child born before the age of 30, you are decreasing your chance of getting breast cancer by around 25 to 30%. So it is a very simple this, that you have to marry somewhere around this. Don't delay your marriage to 30s. So the first child after the 30, you are increasing your risk. So better to marry somewhere around 26, 27, and then have your first child early, then keep a gap for the second child, and then you can go that way. And have good breastfeeding at least for 6 months, minimum for 6 months. Best is for 2 years. That's why we see very low number of actually breast cancer in Muslims, this religion. That is because the breastfeeding is the best in Muslims. They give at least for 2 years, 3 years. They continue breastfeeding very well. So it is a very number of breast cancer are quite good, less in a Muslim population. It is the highest
Okay.
in the Parsi community because they're a very small community. They marry among themselves, so the genetic factor is little exaggerated in that area. In Goa, if you see, the Christian community has got the highest chance of getting breast cancer compared to the other communities, because they are like a Western style. They are more career oriented. They marry late. They have first children also late. So all these things make a big contribution in increasing number of breast cancer. And diet, as I
Okay.
have told you, for colon cancer. Yeah.
Okay. Recently, experts have released the data, like doctors from Indraprastha Apollo hospitals presented a data of at least 100 women, out of 150 women with breast cancers postponed appointment due to fear. So
This is
they
very
said
common.
that an increasing
This
number
is
of
very
women
common.
with breast
Yeah.
cancer delay their appointments with an oncologist. Is this
Very,
the
very important. Yes, absolutely. I would say that minimum time they spend after they have detected the lump, minimum time they take to come to the doctor is around 3 to 6 months. And
Yes, absolutely. I would say that minimum time they spend after they have detected the lump, minimum time they take to come to the doctor is around 3 to 6 months. And it is not that it is that they don't know that they don't have lump. Forget about this. If suppose you don't feel anything and you are just coming for a mild pain or something, that's a separate. Here you are feeling the lump in your breast. Still you are delaying to coming to the doctor by 3 months. It is actually not pardonable. And they have a n number of excuses for them. They will give you so many excuses that no, I don't have time. And some religious festivals are there, some weddings are there in the family. They will try to find out all this. The basic cause is that fear. That fear is there inside, that if I go to the doctor, if he detects it as a cancer, and then then what, that fear is always there in the mind. What will happen to my children? What will happen to my husband?
Mhm.
Ladies are more worried about the family. All those things makes a difference. Even exam going, suppose son is in the 10th standard, 12th standard, they tend to postpone the things till that exam is over. Just don't realize that your health is a priority in the family, because we always consider the mother is the center of the family, because she controls the full, what the children will eat, what the husband will eat, what are their habits and other things. So she'll compare. So if she is sick, the full family is sick. If the husband is sick, the wife can take care of the husband, she can take care of the wife, children, she can cook for the family, she can go for work also. She's a multitasking, she's an amazing creature by the god, which has given them all this multitasking facility. While if mother is sick, the husband is in all the doldrums. He just doesn't know how to take care of the children, he doesn't know how to take care of the wife also. Neither he will go to the hospital, he is more stressed. So but wife can handle all these things well. So keeping a wife or mother or a child, mother is the king of the, I would say she is the queen of the family. She has to be healthy, then she has to come early to the doctor, get treated, because the survival of all these things are excellent nowadays. The cancer is not days, and cancer compared to the death is gone days. They are gone days. They have almost normal life, almost like I would give you breast cancer, if come in stage 1, almost normal for 90-95% of the people. Stage 2, it
Okay.
is around 80%. Stage 3 is around 6-70%. So, only if you come in late stage, then is a problem. But if you come in time, I think you can save the breast, you can spend less money, and you can live longer. These are the three plus points. The organ saving also is a very important part.
So in terms of what are the statistics of cancer in India, the current statistics?
Yeah. In India, we see approximately around 8 to 10 lakhs, but I would say around 8 to 9 lakhs of new cancer patients every year. Out
Every
of
year.
them, we actually around 3 lakh people die every year also.
So
And
has
out
this
of these three,
is this
out of
increasing
these
or is
3
this
lakhs which
still
die,
still figure?
almost out of these 3 lakhs which die, 25 to 30% are all tobacco related. So these are
Okay.
preventable cause of cancers. So this that preventable cause, at least we should, whatever is in हमारे हाथ में, whatever is there in our hand, I think we should try to do that, so that
Mhm.
anti vices, as away from vices, have a lot of vegetables, fruits, have a good exercise. And as I told you about the breast cancer, you can follow all those guidelines. But it is very important to realize the number, as you say, the number is going to rise. See, you have to
Okay.
understand, in 1947, when we got the liberation, our average lifespan of a lady was around 45 years, and gents were around less than 49 or something, around 40, just around 40, just less than 50s. So you can imagine that time. Now it is around
Okay.
65 and 70 years. So we have added around 20 years to our life. That 20 years is also later part of the life. So that cancer is going to increase. It is increasing, maybe around 6 to 7%, maybe 8% rise will be there in every field. That rise will be a common rise. I mean, I won't say it is because of any particular reason, but it is because of our life. Our life has increased over a period of life. period of the life we're living is increased by around 20 years. So all these cancers, and if we survive tomorrow to 100 years, suppose every person survives for 100 years, on all males will get a prostate cancers. Almost 100 people will get cancer patient. So the
Okay.
chance of getting cancer, if you survive 100 years, suppose everyone survives 100 years, almost everyone will get cancer sometime or other. But we don't survive that. That's why the number is little less. So like in India, if you see, for every 10 people, at least one will develop cancer in the lifetime. One or two maybe develop in the lifetime. So this, you have to understand that because people don't survive that long, that's why the cancer may not, because people die of heart attack, people die of accident, people die of other diseases, infective diseases and all of those things. But if you everybody survives 100 years, almost everybody will get cancer.
Okay. When should one go for diagnosis, and how they can figure out if they have cancer or they are?
Are two things in diagnosis. One thing, when you are symptomatic, that means you have some symptoms. If you have some symptoms, you have to go immediately for a doctor. Firstly, your physician, your family physician. One thing I want to send a message: if any symptom in the body which does not, decrease over a period of 3 weeks, then
Okay.
you have to go for investigations. Then you don't sit
Oh,
with that, that no, this is nothing. I will get all right, I will get all right. No. By normal body mechanism, anything in the body, by 3 weeks to 4 weeks, everything should come to normal. If no, your pain increases, your anything which is increasing in size, increasing in the intensity for over a period of 3 to 4 weeks, I think you must go for investigation. Unless you have a lump in the breast, then you have to investigate immediately. You don't have to wait. But something which you can't detect, like you have fever, you have pain in the back, which is, you just can't find a reason, and then you have to do more and more investigation till you come to the conclusion what is the cause of that pain. Other thing is regular checkups. Regular checkup should happen. First checkup should happen somewhere around 40. If you are suppose absolutely healthy, you don't have any problem, then first thing should happen somewhere around 40s. Like I would advise a mammography, a baseline mammography for all the ladies at the 40s. After that, you take a doctor's opinion to do the, it is yearly or 2 yearly or 3 yearly, or you come for a regular yearly checkup and get yourself standard checkups, at least all blood investigation, chest X-ray, ultrasound, simple things which are available. In case you have some symptoms, you can do those organs related investigations to be done.
okay. So, is there any correlation between cancer and
Symptoms.
COVID-19?
Now symptoms. I will come to the symptoms.
Some symptoms are very, very important. Some importance are important. See, most of the symptoms are same as others, but important is something like any ulcer in the mouth which does not heal. See, there are a lot of ulcer which heals over a period of 5 days, 8 days, 10 days, but something which does not heal over a period of 3 months, 3 weeks, then you must come to the doctor immediately. Then swallowing difficulty. You find that when you take chapatis, suppose you have normal chapatis, suppose over a period of time you find that I have to drink water to push that chapati down, is a very important
Mhm.
symptom. You must come to the doctor immediately. Then loose motions, which is with the blood inside. Most of the time it may be because of piles also. But first, you don't take your opinion, or you don't go to Google. You first go to the doctor, get yourself checked.
Okay.
It may be simple or problems, but if the persistence is there, there is a blood coming in the stool continuously, then even colonoscopy is warranted. Especially you are in the age group of 35, 45. In this age group, then you must do investigation. Unexplained weight loss. If it is not because of thyroid hyperfunctioning of thyroid, you have to rule out something in the body. Then you have to have something for any lumps. I have said breast cancer, it is very easy. If any lump in the breast, anywhere in the axilla, anywhere in the neck, anywhere in the groin, any swelling in the groin, all these important areas, you must come to the doctor, get at least one needle biopsy done in minimum. At least that much you should do, and then you can do. The next important part is menses. If suppose you have stopped menses and again restarts menses, you have to come to the doctor. Then loss of voice. Voice is decreasing. Most of the teachers might decrease their voice when they are, sometimes they have to shout loudly, but rest should improve the voice. the rest does not increase the voice, or the quality of voice going down continuously, then you have to do the test. And any bleeding anywhere, suppose blood is, you are passing blood in the urine, and if it is painful, you don't have to worry, because painful is normally because of stones. But non-painful passing urine in the this urine is a important this symptom, you must come to the doctor. The same thing is that is about when you cough and in the sputum you find blood, then you must come to the doctor. It may be because of tuberculosis, but you have to rule out all important causes of cancer. So these are the all symptoms. And important other symptoms is don't feel like eating. Normally used to use eat around 3-4 this mud rice of the rice. Now you suddenly find that after having one cup only, you feel full. You're not feeling all right. This all may be symptoms, maybe of simple acidity and all. But please go and investigate. If you are losing weight, you're not feeling like eating. If you don't have jaundice, all these things, then you have to come and investigate yourself. That is important. All these symptoms look very simple symptoms, but unless you are not getting all right, then you must come to the doctor.
So people should not follow Google and see these
Google
symptoms.
is
Google, Dr. Google, I call him Dr. Google only. Dr. Google is one, but please don't depend on Dr. Google. Because Dr.
Yes, sir.
Google sometimes will tell you, yeah, your breast lump is there 90% of the time, it will be benign. Now you don't want to think that it's malignant. You want to think it is benign only. Then you see, yeah, Dr. Google also said that it is benign. So I will wait for more time. So Google will give you statistics, but finally to interpret that and all, you require a doctor who knows you well and who knows your family well. So the family physician is important. And then you go to the consultant whenever he refers to you.
Correct. As we all are suffering from COVID-19 and we are under the wave of pandemic, many are still in home quarantine, and many might be suffering from cancer. So is there any correlation between cancer and COVID-19, and what are the precautions that these family members can take?
No direct relation between COVID and cancer, but COVID delays the
Okay.
diagnosis is one of the most important part. And people don't want to come to the hospital immediately. They would like to take all these kadas and other things. They will go on what you call video counseling. In video this call, you may not be able to examine the patients properly. So you may miss something on a video call, which clinical visit may do. But because of COVID threat, nobody wants to come to the hospital, because of especially the elderly population who are at high risk population. The high risk population only is not coming to the hospital. So this problem is there, but COVID by itself will not give rise to cancer. And second thing, COVID will give rise to complications of surgery. Suppose you are already having some lung problem and somebody operates on you, then your chance of worsening those lung problems are quite high. So you require a good investigation proper. You see that your checkups are done properly to see the risk involved in cancer versus risks involved in COVID. If you consider that and the doctor come to the conclusion that yes, your cancer is more important to be treated, I think then we can take some decision on that. But
Oh.
let the doctor take a decision on this.
uh, Google everything, but still many are not aware of the side effects of using certain things like smoking, and the cancer awareness is still not there. So how can we increase? How can government increase and implement the on spreading awareness to every section of the society?
I think prevention is better than cure. This still holds good even for cancer. Yes, not all cancer.
Prevention is better than cure. This still holds good even for cancer. Yes, not all cancer are preventable. There are a lot of other things which are not, but I would say at least 30-40% of the cancers can be prevented. First important thing, as you said, is smoking, or for that matter, tobacco in any form kills.
Mhm.
That we know that tobacco kills, and it's a preventable cause of cancer. Then
Okay.
alcohol. Alcohol also can cause is a carcinogenic. Plus, the third is uh, processed food or red meat as far as possible. So these are the three which is there in our hamare haath mein. It's like in our hands to nobody is forcing you to smoke or drink or eat that thing. But you are doing it for your you want to take the pleasure out of it. So it's very
Mm-hmm.
important to realize that tobacco is a preventable cause, alcohol is a preventable cause, and food also is a preventable cause. So as far as possible, try to avoid all these things. Maintain your weight properly. Obesity is now a new in thing for a cancer. Obesity also can be one of the risk factor for cancer. So it's very important that you have to maintain your weight properly. You have to do regular exercise, go for running, swimming, cycling, whatever you love to do. And the other thing which I have told you for the breast cancer is timely getting married, timely having your
Right.
first child, good breastfeeding. All those things are very important. So these things can be like government, rather than government, there are a lot of NGOs who are working in this field who can
Mm-hmm.
be of very helpful in doing all these things. A lot of print media, electronic media, celebrities who are getting cancer, they are also spreading some good news on these things. But I would love all these celebrities to stop advertising the surrogate advertisements on for the gutka, pan masala, and smoke, alcohol, all these things. I think they
Okay.
should refrain from this, and government must bring some good legislation that exactly what is the surrogate advertisement, what is the indirect advertisement, because they have made laws that there should not be indirect advertisement. But
Mm-hmm.
we are seeing that and they target the population properly. They know that these young children will watch cricket, so they watch movies. So in between this only they will insert this advertisement. See, the companies are so powerful. They are flush with the funds. So all these companies put in a lot of money. They have surrogate products like elaichi and some non-specific this our pan masala doesn't contain tobacco and all, and they try to influence this younger generation. See, it is very important to realize it is extremely difficult to leave smoking once you start, for that matter any tobacco in a tobacco form. It is just next to heroin and all, that much is the powerful addiction. So, in spite of all our efforts, only 30% of the smokers or tobacco chewers, we can tell them to leave smoking or quit smoking. So, 70% of them will continue to smoke to the grave. So, you have to understand that you better not to start only. It is very easy to say, I will smoke today and I will stop tomorrow. It just doesn't happen. It is an extremely
Mm-hmm.
difficult addiction to quit, and I think it's best to not to stop. See, you have to understand that if you want to decrease the mortality of cancer now, immediately, then
Mm-hmm.
those who are smoking or using tobacco in any form should quit it immediately. Then we will have immediate effect of it, and immediate death rates will go down. But if you want to have a long-term strategy, then you have to concentrate on children, the school children, 8th standard, 9th standard child is 15, around 10 to 15-year-old child. And if you put that in the curriculum of the school, that tobacco is bad for health,
Mm-hmm.
and what diseases it can cause, what benefit is there of quitting smoking, all these things, are simple things are put in the curriculum. I think the children will grow with a negative image of the tobacco, and over a period of time, I think the initiation of the tobacco by the children will stop, or it will decrease. I won't say it will stop, but it will at least definitely decrease to such a point that it should be less than 10%. 10%, like
Okay.
Goa, we are in the 10% bracket. But if you see UP and Northeast states and all, it's in the bracket of 35, 45%. So the number of oral cavity cancers seen in the Northeast and the UP and Bihar and all is quite high compared to Goa. Goa, we are seeing only about 20% of the oral cavity cancers or anything related to the tobacco, just because our overall tobacco use is less than 10%. So
Okay.
it does help in decreasing the cancer patients if you are not using tobacco, alcohol, or for that matter, processed food.
Okay. So, what suggestions would you will you give to the people of India on their lifestyle, how to
See, there
maintain the
is
lifestyle and
there are
everything?
three magic bullets. There are three magic bullets for a healthy life. Not
Okay.
only cancer, for overall, for even heart, for other things, three magic bullets. One is stay away from vices. That means, as I have told you, stay away from tobacco and alcohol, if that matter. These two things are important. And mind you, I will speak only of 5 cigarettes. I am speaking not the chain smoker. Forget about this. You have to just decide you want to die for AK-47 or you want to die for pistol. Both will kill you. So please don't say that I will speak only 2 cigarettes per day. I need to pass, motion ke liye I will require one more cigarette at chai ke saath. I will require these things are out. So either you
Hmm.
should be off the vices. Second important thing is, as far as possible, have lots of vegetables in your food, leafy vegetables. You may be like, I love eating fish. Fish is the best thing what you can get. Fish will never give you cancer. Eggs will
Okay.
not give you cancer, but the red meat can give you. So as far as possible, try to avoid red meat. Once in a while is okay. Or even for processed food and all this so-called junk food, try to avoid all these things. Once in a while, okay, no problem. But for children and all, but not a regular, you should be eating all these things. And last is, keep yourself healthy by having good exercise. Keep yourself fit, keep your body fit, have running, cycling, swimming, whatever possible you can do a lot of yoga and all, and I think it will help you giving a very healthy and good life.
Okay. Okay.
Thank you very much. Yes.